I'm Denise, and I have a 6-year-old and 2-year-old twins. Since my kids were born, I have lost most of the weight, but there's still areas that just aren't the same. The part of my body that I'm having the most trouble with is my stomach. There's areas that are going over my jeans, and there's just more on my tummy than I'd like there to be. Is there any way to get rid of this extra fat I gained from the babies?
Well, we're now joined by Denise and board-certified plastic surgeon Dr. Michael Brucker, who has a new treatment option for Denise, looking to lose a little of that, what shall we call it, residual...
baby weight.
Stuff, yeah.
So what do you have, Dr. Brucker?
This is the TrueSculpt device, and it's basically a little heating pad, essentially. And we pick an area. And on Denise, we're going to go ahead and treat right around the belly button, so we're going to have her lay back. It's really, really simple.
No topical anesthesia?
No topical anesthesia. We put the device on.
It's all about the heat, right?
It's all about the heat. What the heat does is it injures the fat cells enough that the body, over the course of maybe 2, 3, 4 weeks, sort of takes those fat cells away. We're in a constant state of removing and building fat cells, and this is a non-invasive way of getting the body to remove.
Radio frequency heat.
Yep.
And we know that you're going to get a certain degree of skin contraction with that.
Yes.
Going to involve more than one treatment, right?
Almost always takes 2 treatments per area.
So
And I'm curious, when you start talking about removing these problem areas, you call it the residual baby weight, which so many women have.
Yes.
The big thing is sometimes you can get rid of it, whether it's liposuction or this is a new treatment. What's the risk of it, quote unquote, coming back?
You know, I think as long as we stay healthy, watch our nutrition, I think a lot of these treatments are permanent.
And so how does someone decide, Dr. Worden, if you're going to try something new like this versus the more traditional?
Well, exactly. You have to have a discussion with your board-certified plastic surgeon. If somebody has more things going on, they want the best they can be, they may opt for a more invasive, bigger procedure. But that means surgery, anesthesia, recovery.
Absolutely.
The expense and the treatments are anywhere from $750 to $1,500 per
That's for this device right here?
Usually takes about 30 minutes, 45 minutes per area to treat. Patient gets up, goes about their normal day. How's this feeling right now?
It's fine. It feels great. It just feels warm.
It takes it up to 43 degrees centigrade, which is about 112 degrees Fahrenheit. You know, it's kind of like stepping into a hot bath. You kind of get that little bit of
and selectively targets the area where you want that
Yes.
heat and not damage.
And that's the beauty of this device. I think it's really, really consistent, delivers even heat right across a very, as you can see, you know, about a couple-inch area there.
Dr. Brucker, thank you so much for being here. Denise, best of luck to you. We appreciate it.